Your Speaker, I rise to support this bill because this bill delivers on an election commitment of the former coalition government to increase the income limits for the Commonwealth Seniors Health Card. And this is important to the electorate of Casey because we have 2,812 people on the Commonwealth Seniors Health Card, 15,729 on the age pension and around 24,000 people aged over 65. On the 2nd of May, the Coalition announced their policy to increase the singles income test threshold from $57,000 to $90,000 to give more senior Australians access to the concession card. The couples threshold would also increase from $92,000 to $144,000, and I heard from many of my constituents during the campaign on the need for more support for aged and seniors, so I'm so glad that this policy has come through. And I do note that Labor quickly adopted this coalition policy during the election, and they're now obviously trying to claim it as their own, but it's great that this has been delivered for senior Australians. The measure also gives an extra 50,000 older Australians access to more affordable health care and medications to help ease cost of living pressures. The cards are available to Australian residents over age pension age who are not already receiving a pension and have an adjustable taxable income under the threshold. We will, of course, be supporting this bill, as I said, because this was a coalition initiative, although it's disappointing to note that Labor have decided to push the start date out to the 20th of September instead of when it was originally announced for July. And as we know, many Australians, particularly our older Australians, are struggling with rising inflation and need support straight away. It's another example of the current government not having a plan to help Australians today or this week, but pushing initiatives off to September like a jobs summit that doesn't help anyone today. This initiative should have been put in July to support Australians, but I'm glad it is coming in better late than never. Currently, more than 436,000 Australians aged over 67 years who are not already receiving a pension or benefit will have the Seniors Health Card. So senior Australians have worked hard to make Australia all it is today, and it is important that the country takes care of them in return. This is a good policy, and I can only hope Labor adopts more of the Coalition's policies to ease the cost of living pressures on seniors and indeed all Australians. It's another example of why this government needs an economic plan to deal with the challenges coming our way. There's increasing pressure with inflation, increasing pressure with rising interest rates. So we need a plan to deal with these pressures today.